Okay, first thing, one by one you write. Neutrophil. Neutrophil helps in acute inflammation or phagocytosis. Okay, focus that point, phagocytosis. So that inflammatory response is mainly mediated by this neutrophil. The first WBC to reach that particular site of wound or cut is the neutrophil. What they will do there? But monocytes, chronic inflammation mediating. In the blood, it is called as monocytes. When it is traveled to or migrated to the tissues, okay, in particular tissues or organs, then name will be changed. There it will be called as macrophages. I can give some examples. And a special policeman there. If any microorganisms in invading to that organ, they will defend against that. Okay. For example, liver, Kupffer cells are there, macrophages. Basically, it is a monocyte. Skin, Langerhans cells. Brain, microglia, macrophage. For brain's macrophage. Then what else? Lungs, alveolar cells. Bone, osteoclast. Then kidney, mesangial cells. These are the macrophages. Basically, they are monocytes. They have migrated from the blood to the organs. There they act as a specific macrophages. Mainly two types, T lymphocytes and B lymphocytes. T lymphocytes is activated in, matured in thymus gland. So that the name T lymphocytes, T for thymus gland. B lymphocytes are matured in bone marrow itself. So that the name B lymphocytes, B for bone marrow. T lymphocytes provide cell-mediated immunity, whereas B lymphocytes provides antibody-mediated immunity. T lymphocytes is also called as CD4 T cells. I think you may be knowing, especially those who are working in clinical areas. In HIV, the patient is losing cell-mediated immunity. How? Because HIV, that particular virus, is targeting mainly these T lymphocytes, helper T cells. CD4 T cells will get destroyed in the HIV infection. So, the logic is cell-mediated immunity is lost in HIV infection. With that antibodies, they are defending. Microorganisms or antigens will be neutralized. Like that way, indirect way, they are providing immunity or destructing the microorganisms. So that it is called as antibody-mediated immunity. These antibodies are mainly seen in the plasma or fluid, so that the name humoral-mediated immunity. Okay. Or one more thing, B lymphocytes are again in turn divides into two types, and these are memory B cells, and second one is the plasma cells. Okay. Actually saying that plasma cells are producing the antibodies. Okay, plasma cells are producing the antibodies. Plasma cells are a type of WBC which produces antibodies. Don't forget it, because in cancer, oncology, one topic I will teach you, multiple myeloma. That is nothing but the cancer of the plasma cells. Okay, there we will discuss about that. The hemostasis is nothing but cessation of bleeding. So for this stoppage of bleeding, there are some steps or stages. Okay, one is vasoconstriction, second one is platelet plug formation, third one is very complicated or complex process, coagulation cascade. Okay, platelet will be adhered to the or stick to the damaged blood vessel. Then that attached platelet will be activated. This is now called as activated platelet. This activated platelet will secrete or release serotonin. Okay, a chemical substance called serotonin. See, serotonin is a vasoconstrictor. Okay, then with the help of serotonin, this blood vessel will get constricted. Okay, constricted. That plasmin. Okay, with the help of plasminogen, activated plasminogen will be converted to plasmin. That plasmin will destruct the fibrin clot. It will be broken into small pieces. That small pieces will be taken up by the macrophages, and it will be nicely disappeared from there. Understood? Deliberately I said this because in pharmacology the topic will come thrombolytics. The basic mechanism of thrombolytics is we are giving the plasminogen activator. Understood? Like MI, myocardial infarction, the clot will be there, and DVT, clot will be there. For that sake, we are giving what that plasminogen activator. Okay, the plasminogen activator, they will make it convert to plasmin, and plasmin will destruct the clot. Okay, and one more thing, the plasmin will destruct the fibrin into small pieces, I said. Okay, this is called as fibrin degradation product, that waste materials, FDP. D-dimer is basically FDP. Like these clotting processes, if like these clotting diseases like DVT or pulmonary embolism, okay, we are checking this D-dimer, because once the clot occurs in our body, definitely there will be waste of it, right? So we can indirectly we can check the clot formation by assessing the FDP, that is called as a D-dimer. Okay, the complication is simply we will tell as sickle cell crisis. It is further subdivided into some types. Okay, under this sickle cell crisis it will come. First one is vaso-occlusive crisis. Okay, vaso-occlusive, the name itself suggests that vaso means blood vessels, occlusion means obstruction, right? And crisis, what will happen? I already said that in small blood vessels, RBCs will be clumped, okay, clumped, which may result in ischemia and in necrosis or infraction. Mostly it will affect the joints, that you don't forget. Joint pain is a characteristic symptom. Okay. Splenic sequestration means the same problem here. Clumping of cells and also pooling of blood occurs in the spleen, which may result in what is called as partition of the spleen and damage to the spleen. So the reason here in sickle cell anemia, the splenectomy may be done for the patient. Okay, surgical option. Understood? Simply due to deficiency of iron, manufacturing of RBCs or hemoglobin is compromised. That is called as iron deficiency. What may be the causes? Orally, if we are giving, means there may not be any guarantee that it will be properly absorbed. I already been said it is very iron absorption is very limited. Okay, some average it is less than 10% is the absorption rate of the iron. So in sometimes we cannot take the risk. Okay, especially like a pregnancy. So oral intake may not be sufficient. That time we can give iron supplements. Okay, iron supplements. While giving iron supplements, we should give vitamin C rich food or multivitamins. Okay, why? Because vitamin C is the nutrient which helps in the absorption of the iron from the gastrointestinal tract. Don't forget, very important. Vitamin C helps in the absorption of the iron from the GI. They may not ask directly this point. They will be cunningly asking to you that because it's very important and commonly they have been asked. Okay, because milk inhibits the absorption of the iron, so that you are not supposed to give milk along with the iron. Okay, very important. If the cause is autoimmunity, then the best treatment option is immunosuppressants. Okay, because here the villain is WBC, so we have to suppress it, right? Okay, so that we can give immunosuppressants, especially like here the drugs mainly used are anti-lymphocyte. Just write it down. Anti-lymphocyte globulin, azathioprine. These are the immunosuppressive drugs we are using, and also corticosteroids. You may know that corticosteroids are anti-inflammatory drugs and also can be used as immunosuppressants. Okay, corticosteroids. Simply steroids. APTT, activated partial thromboplastin time, is the coagulation study to monitor in hemophilia. Okay, very important point. The patient should avoid contact sports. Okay, contact sports, there may be chances of heating, okay, which may result in bleeding. So like football, hockey, these kind of sports they should avoid. Instruct the patient to wear protective devices while involving in sports, like helmet, knee pads, etc. Okay, and swimming, this is a frequent question. Swimming is best for the hemophilia patient. Okay, swimming, there may not be any chance of hitting, no, so that it is not a contact sport, so swimming is best. They should use soft toothbrush, so that there may be less chance of gum bleeding, and also they should use electric razors for shaving. Okay, and avoid nose blowing. These are the precautions to avoid the bleeding. Pharmacology of blood. Only 3 topics are there: anticoagulants, thrombolytics, and antiplatelets. Okay, first one is anticoagulant. See, the point is why anticoagulants are used. Okay, anticoagulants are used to prevent the formation of new clot. Okay, on the other hand, thrombolytics are used to disintegrate the already formed clot. It is a different. Okay. Heparin sodium antidote is protamine sulfate. Okay, while giving heparin, which coagulation study has to be monitored? APTT, activated partial thromboblast in time. Okay, and next one is warfarin. Warfarin antidote, vitamin K. Okay, and I forgot to say heparin sodium intrinsic pathway checked. That's what APTT is monitoring. Warfarin, the mechanism of action is it is a vitamin K antagonist. Vitamin K antagonist means it will destruct the vitamin K in the liver. Okay, you know there are some clotting factors which are dependent on vitamin K. 2, 7, 9, 10. These are the clotting factors are formed in the liver with the help of vitamin K. If you are destructing vitamin K, then how these clotting factors are formed? Okay, which may consequently results in problem in the clotting. Understood? So we can use it as an anticoagulant. Which one? Warfarin. Warfarin is an vitamin K antagonist. And one more logic, if there is problem with warfarin toxicity, okay, if there is warfarin toxicity, vitamin K will be decreased. So that what should be given? Vitamin K should be given to counteract that. Okay, it is some glimpses from our new crash course in English. This is actually useful for those preparing for DHA HAAD, MOH, Prometric Nclex-RN, NHRA exams. But it is also useful for government exams like AIIMS, JIPMER, NIMHANS, etc. This crash course is available in Nursingflix lectures app, which is there in Playstore. You can download it from there. This, which means total package, includes more than 60 hours of theory classes. It has anatomy and physiology, medical surgical nursing, OBG, pediatrics, psychiatric, almost all the nursing subjects we are dealt with here. And also you will avail a crash course test series. Okay, in that you will avail around 10,000 questions. Okay, the questions, the significance is which is very important and repeated questions. Okay, that will be in the form of test series. So after downloading the Nursingflix lectures app, you can attend the free demo class. Still, if you have any queries or you want to get more details, you can freely contact in our WhatsApp number.